And for this next few weeks, my series is going to be focused on how to heal from chronic inflammatory conditions. So let's start at the very beginning. Like, what is chronic inflammation? So inflammation is usually associated with just the physical body. So for most of us, we've experienced some type of physical pain or swelling or heatedness that was caused from maybe an injury, disease, or irritated tissues in the body. And so we've experienced either acute, which is short-term pain, or could be chronic, long-term pain. My consideration for you is to also look at inflammation from a more holistic perspective. And that is, we also have mental and emotional inflammation as well. So we experience mental or emotional pain, swelling, meaning like information overload could be an example, or heatedness, like frustration or burnout. Those could be examples of mental emotional inflammation. The chronic symptoms of mental emotional inflammation could be things like anxiety or depression. Those are kind of the big two, but also, other forms like worry, nervousness, sadness. Those types of emotions can be more acute inflammation. So now that you kind of get my perspective of how I view inflammation, and I think they kind of blend into one another. It's hard sometimes to separate which one starts the other, or there might be one, like maybe your physical body is having inflammatory issues more so than you feel mental emotional. But I think both in some way are there. We might be experiencing one more because it just gets our attention more than another. So here are two things that I think could be really helpful for you to start to cool down this heated feeling or sensation, whether it's in the physical body or the mind. First thing, this is one thing I really had to practice when I was struggling with back pain from scoliosis, and that is to watch your pronouns. So for example, for many, many years, more than I could even count, I would say my scoliosis or my back pain, which causes me to not be able to do the things that I want to. That pronoun of my is creating ownership with the symptom. So just something to be aware of. How do you speak, which is energy, or whether that's externally speak, or if it's internally in your mind, your thoughts, about how you associate with the particular inflammation. So instead of creating ownership of my back pain or my anxiety, whatever that symptom is, consider using something neutral, like the or this. So for me, I started to switch to the back pain that I am experiencing now. Or you could do the anxiety that I am feeling right now. And know that we are constantly in a state of change and flux. So when we begin to just create a little bit of separation in our language and in our mind and thoughts around our symptoms, we can actually really start to shift our perspective, because we are not our symptoms. We are definitely not our whatever diagnoses you may have. So that's the first thing. Just begin to be aware of your pronouns and switch it from instead of my into like the or this. The second thing is focusing on what you do want as opposed to what you don't want. And I know this sounds really simple, but as humans, our reptilian brains are wired to avoid suffering, but we tend to focus on the suffering, on the what we don't want. So for example, for me, I had this repeated mantra in my mind of, I don't want any more back pain. I don't want any more back pain. And I just kept repeating that to myself over and over. And even though, yes, the word don't is in there, I'm still focusing on back pain. So whatever it is for you, whatever inflammatory condition, whether it's physical or mental, emotional, consider reframing into what you do want. So for me, it was, I can experience ease in my body, or I am open to joy in my mind, or I like the statement, I am open to, or I am willing to experience, and fill in the blank of what you do want. So I hope those 2 suggestions are helpful. Play around with it, see what you come up with. So again, be mindful of your pronouns, switching from a my to a the or this, something more neutral, and then focusing on what you do want instead of what you don't want. That will intentionally bring the energy into what you want to create and manifest for your new year. Thank you so much for listening, friends. I really hope this was helpful. Please like this video if it was helpful to you. Subscribe to my channel, and I will see you next week.